Dr. Danyo.
Clark.
I can see you. Normally we're always, audio only, but man, it's so nice to see you today.
I know, it's awesome. It's been 6 months in the work, to get this thing all put together to do a video podcast. So this is our first one. It's awesome.
It's great. I love it when you put your mind to something, you find a way to not just do it, a good job, but to do it excellent. And you're looking great. I love the setup. I feel like you're going to unlock a lot more potential for what you're doing over there and for education, for conversations like this. I mean, I can't wait, man. So we've got some good things planned for our conversation today, but I wanted to maybe just spend a moment on, now that I can see you and see this great setup, what have you been working on with the studio? And in your own words, what do you think you can look forward to with the new possibilities?
Yeah, well, the studio is state of the art. I mean, I've got a computer to my right. I've got monitors here. I've got a soundboard. I've got a stream deck to produce shows, and then we have a video mixer as well, and just a lot of wires that we've actually done a great job concealing, which is all on this mobile desk in this really nice studio. I mean, we built it out. We knocked down a couple walls and took a door out and put a glass cube in to kind of showcase it in the office. And patients love it. But, this will give me an opportunity to talk to you directly like we're doing now. I'll be able to have people call in, do interviews. I can do my own my own discussions, really. There's so much to talk about. I mean, we've been through it with the audio podcast, but it's going to be great. I mean, this studio is really something that will propel me for like the next 10 years. I can't imagine that things are going to go way out of date with what I have right now. So it's awesome.
Wonderful. I know your patients have got to be super amped up. And that's also complementary to a really cool space that you've thoughtfully designed.
They get to meet you. I mean, I can't tell you how many people are like, man, I want to meet Clark.
That's so cool. Well, hello to our listener, watcher, viewer following along. It's so nice that they can have this elevated experience with us. So let's jump into the topic today. And Shave-Less FUE, common topic, right? And I really want to understand some of the limitations or challenges or possibilities with this, and just to set the stage for someone, if this is maybe their first foray into like, hey, what is a Shave-Less FUE? Can you just kind of set the stage for us on what is this and why does it have so much attention?
Sure. Well, I mean, the Shave-Less FUE was really developed to be able to do the procedure without having your hair shaved. A lot of places shave the entire head, and if you're working and active in social activities, I mean, shaving your head is just an absolute bummer. So, and really, especially for women, I mean, it just pretty much can prevent them from actually even doing a great procedure. So the Shave-Less FUE for me is not new. I mean, I've actually been doing Shave-Less FUE since about 2013, 2014. So it's, I'm on my 10th anniversary of actually doing it. And in my practice, it's really what we're known for. It's about 7 out of 10 opt to do a Shave-Less FUE. And basically what that means is we don't have to shave your donor site, and we don't have to shave the top of your head. And the way we do it is something that I've worked on for a number of years. It's very hard to do, actually. And that's why it's really limited in its scope as far as people actually doing this and offering it to the patients.
FUE, what does that stand for again?
Follicular unit excision.
All right, and so that's basically like the movement from the donor site. I've always liked to think of it sort of as like you're replanting a tree, right?
Exactly.
So you pick it up from the donor site.
Yes.
By the roots, and you're replanting that
Correct.
tree or that single hair elsewhere.
Yes. So when we're extracting hair, like, when I do consultations, people always ask me, "Am I going to have any hair left after you do, say, 2,000 grafts?" And the nice thing about a shaveless FUE is because I see over harvesting a lot, especially people that go overseas that get way too many grafts done at one time. But the shaveless FUE really is like a safety gap for over harvesting because you're cutting and coring each hair as you go and leaving everything else long. And then there is, a greater ability to, kind of see the density that's left after you extract. So it's a safer procedure. The healing is a lot quicker, for one, because your head is not shaved. I mean, if you had 2,000 wounds on the back of your head and you're laying on a shaved head, I mean, that's a lot more painful than longer hair. So that's another advantage of doing a shaveless FUE. But really, the decision for shaveless comes down to the patient because there's really no difference in the results. And I get that a lot. Well, I want the best results. I want to shave my head. Well, that doesn't really come into play because the grafts are the same, and we make sure that they're the same as if we shave the head. So it is a little bit, extra cost-wise, but we make it very affordable. And we make it so that, 7 out of 10 of our patients choose it. So having it available and really having an option so that people can get back into work. I mean, I've had people go back to work the next day, which is outstanding. And for me, it's a labor of love, really. I love looking at the expressions on my patient's face when I show them the donor site, and they can't believe that it looks the same as when they walked in for the procedure. So it's an art form. It's not easy to do, and it takes a really dedicated team to actually pull this off, and that's what I have.
I love that you call it an art form because it absolutely is, right? This is a really advanced procedure. I know you have a great deal of care that you put into this. I am not a doctor. I'm not the one doing this kind of procedure. I don't quite understand what it really takes. And so can you help me understand, and for anyone else, right, who might be curious, you mentioned you have a team and this is an art form. What's this process like? And I think that might give us some insight into Shaveless FUE. And then after that, I would love to kind of follow up with, are there limitations? Are there challenges?
Yeah,
Are there,
sure.
what else is there to know? But first, I want to talk just a little more about that art form.
Yeah, so, first off, follicular unit excision, doing it shaved is actually a very hard procedure to do. There are a lot of variables. You could have somebody with thin skin that can be tough, or very thick skin. There can be curl, splay, a lot of different factors. So you've got a hard procedure to begin with, and it takes an entire team to actually pull this off. I couldn't do it all myself. So when you add an even harder component, which is shaveless, where we're actually, grafting through long hair, it becomes an art because you're taking this difficult thing, making it tougher. And when I think of art, great artists, they do things, really hard things, and they persevere. And so it takes a lot of perseverance to actually do this and do it quickly and efficiently because a shaveless FUE, when I first started doing it, it was so hard and so time consuming. And then, case after case, just getting experience. Now I've done millions of grafts. Like I said, I've made it into an art form because we're doing something extremely hard. Now my team, the process is I'm coring the graft. So after we numb the scalp, I'm creating a circular incision around the follicle, and then my technicians go behind me and they actually pull the graft that I cored. And that's tough, when there's longer hair, because that hair, the remaining hair kind of blocks it. And if there's any bleeding or especially if it's kind of coarse and curly hair, like with African American females, there's your view of what you're actually doing is diminished. So there's really a cadence, and there's kind of a following of what I'm doing, and they have to kind of stay close to me as far as my extracting. When I do a shave case, a lot of times, because you can see all the grafts popping up, I can just kind of run with it, and they can come back later. But with the shaveless, we try and stay more contained, and then we finish one area, move that hair to the side, and keep going. But my team
How
is
many
awesome.
people?
Yeah, so I have a big team. I have myself, and then I have two physician's assistants, and I can't say enough about my physician's assistants. They're awesome. Um, they help me with grafting as well and implanting. We've talked about efficiency and what we do with the hair transplant. So you're taking a hard case, making it harder, which potentially can make it longer. But now we're implementing things like harvesting and placing at the same time, and doing things to make the experience that much better. Because if you can take a long procedure and cut it down by 3 or 4 hours, those last 3 or 4 hours, trust me, are the worst for the patient, and we can kind of negate that with our efficiency.
I appreciate you sharing a little about how all that works. It helps me visualize it and better understand it. So, as we're wrapping up here with this conversation, any other challenges or limitations that you would bring up as someone's considering this procedure for themselves?
I mean, a shaveless FUE is always challenging. And there are some things that make it more challenging. I have a lot of my male patients that they come in and say, "Hey, I got my hair cut for you." I would say, don't get it cut. It's actually better if it's a little bit longer. If it's, say, less than like a number 2 guard, we try and take care of that hair and move it out of the way. But if it's too short, it just stays there. So it's not a big deal, but it can make it a little bit more challenging, and it also conceals less as far as the donor site goes. The other challenging aspects, a lot of times we're dealing with people that have scars or that have had multiple procedures, especially FUT scars. A lot of the time, there's a line from ear to ear. And so, within that scar, oftentimes there's just no hair, and it can be very opaque. But a lot of times there's also scar tissue that goes more kind of horizontally, across the scar, and can make grafting just a little bit tougher. But because people don't want that scar concealed, there's really no other choice but to do a shaveless FUE, but it just makes it maybe a little bit more challenging. But again, it's nothing that we don't see regularly and don't do a great job as far as grafting. I think the major limitation is really more on the patient side, not so much on what we do with my team and what I do. The limitation is, I would say, more of a cost factor, because it is a little bit more expensive to do a shaveless versus a shaved. Again, we make it affordable, so that's always a consideration. A lot of times, especially with my male patients, that let's say their hair is usually at a number 1 or 2. A lot of people just have a really tight fade on the sides. I usually say, look, let's not even talk about a shaveless FUE. Let's just do a shave case. it's maybe a little bit easier and quicker for us. But our speed doing a shaveless is not an impediment. So I don't really have anything negative about shaveless FUE. I think I can't think of anyone that I've said, I can't do it this way. We're just going to have to shave your head. That's never happened.
Hey, that speaks to you and your passion for this, and that's the decade behind
Yeah.
you. So I know how important all of that is, because what you're trying to work towards is that feeling that they have when they come back months later, and it's a night. I've heard you talk about this before. It's a night and day difference. So that's
Yeah.
the ultimate goal. That's what you're working towards, and I think this has been a great conversation. I can't wait to do another one of these real soon. So with that, Dr. Danyo, thank you so much for sharing your time.
Clark, thank you.
Hey, thanks for listening to Hair Restoration with Dr. Daniel A. Danyo. Book your consultation today with Dr. Danyo by calling 678-845-7521 or online at nahairrestoration.com. And be sure to follow, rate, and review this show wherever you listen to your favorite podcasts.